Can anybody give me what their definition of resident-centered care would be? Anybody? Yes.
Allowing residents more choices in how they wish to be.
That's perfect. What she said was allowing residents the choice in how they want to be taken care of. That's pretty much exactly what the definition for resident-centered care is. So it focuses on the resident as the center of control and supports each resident in making his or her own decisions. Can somebody give me an example of how we can support resident choice in their care schedule?
When they want to go to eat.
When they want to go to eat, that's a great example. Anybody else?
When they want to shower.
When they want to shower, very good.
When they want to get up.
When they want to get up is a huge one. So I know for a lot of years the schedule was I'm going to get here right away from our morning shift. I'm going to start at room 1 and go down the line and get everybody up. That thinking needs to change for every single one of us. We now need to say, okay, what time would you like to get up, and have an understanding of the resident's schedule before they came into our facility. So we really can make this more like a home for them. Just making an effort to understand what each resident is communicating, both verbally and non-verbally. So how can a resident make their needs met non-verbally? So I'll give an example. One of the best ways, or that's not a great way, but a way that a resident can express their needs non-verbally, especially if they're a resident with dementia who has lost that ability to speak, is through pain. So if a resident's in pain, that's a way that they're going to express those needs. So if they're constantly trying to get up out of bed, if they're trying to get up out of that wheelchair and they're at large fall risk, that might be because they're in pain, or it might be because they're hungry. Or if they need to use the bathroom, that's a big one. So just really knowing your residents. Do they have a change in their expressions? That's a great way to know if a resident is in need of something. Identifying what is important to each resident with regard to their daily routines. So we kind of talked about that, what time they like to bathe, what time they like to get up, what time they like to eat. Obviously with meals, we're at a little bit more of a schedule constraint there, just because we do have staff that comes in and out and we have to have our meals prepared by a certain time. But snack times in between, and if a resident would like a snack in between meals, that's more within, that's well within their rights. Understanding of the resident's life before coming to one of our facilities. So how can that information be important to the care a resident receives? So if we have an understanding of our resident's life before they came into the facility, one, that shows that we're really invested in getting to know our residents. But two, going back to residents with dementia who have behavioral disturbances, if you know some of the things they like to do in their past, bringing those activities to them before we give them, say, a anti-psych medication is a great way to help get those behaviors under control. And that's something that's going to be looked at a lot with our new surveys, is the use of anti-psych medication. So really getting to know your residents and helping with behaviors is a great way that we can use information about what they did before they came to us. So I'll let Joanne kind of talk about what's going to be in our baseline care plans a little bit.
48 hour.
Our 48-hour care plans.
Can you guys hear me if I don't use that?
Yeah.
Okay. I've been talking about the 48-hour care plan for a couple months, so our nurses are well aware of what that looks like. But the CNAs, I don't know if you've seen that, but it's a 2-page. It's going to be the same color as that initial care plan. Or are they white? They might be white, but they're on a thicker cardboard here.
The same cardboard.
But on these, it's required by CMS, all of the new topics that we have to make sure that it's resident-centered. So every entity, the therapy, dietary, nursing activities, and social services, within 48 hours should be visiting with that resident or the family in their room and filling out this 48-hour care plan. Our nurses, if it's a late Friday night or a Saturday admit, you guys are responsible for filling this out as close as you can, as fully as you can. Making a copy of it, having the residents sign it, you need to sign it, and they need to have a copy of it. It's per CMS guidelines from here on out. During the week, Corliss, Denise, Marie, and Colleen, they've been really filling these out for you guys, but you need to look at them. It has a med reconciliation on the back. You have to fill it out, you have to put the dosage, and you have to put why they're taking it. You have to go over those medications with that resident and the family member and make sure that that is correct with them, okay? On the front, it's all different categories. You've got your diet, you've got skin, you've got activities, O2, everything. Take a look at one of these when you get back, or it's on every neighborhood. There's a folder with these in it. So I want you guys to all take it out and look at it. Social services puts on the back a PASSAR. So nursing, you know what a PASSAR is? It's the dementia. If anybody has,
It's a screening to make sure that people are appropriate to be in the nursing home.
okay? That should be sent with, if they're coming from the hospital, that should be sent with all of that information, hopefully. If not, we need to let Tamara know right away.
If I know a resident's coming over the weekend, I'll try to make sure I have it on Friday ahead of time. So hopefully in most situations, you won't have to worry about it. If for some reason I don't have it, I will let the nursing know that we need to get it before the resident comes here.
If you can't find it and they say they sent one, look under the scanning. Rose does a great job of keeping up with scanning, so it's probably scanned under PASSAR. She labels it directly that. So on the PASSAR, you just put level 1, level 2, whatever it is. But the nurse's responsibility, late nights and weekends, is to get this done and filled out as full as you can. The only requirements that CMS is making us do on a weekend admit is the nursing has to sign and the resident has to sign. You give a copy to them. Come Monday morning, social services, activities, and all that will go through, and they need to finish filling this out. At that time, they will take a new copy and give it to the resident after they've gone over it, and they'll re-sign and date it down here. Okay? Any questions?
Thank you. So then, after we get that 48-hour care plan done, over the course of the next weeks, we're going to get our comprehensive care plan, and that's much more in depth than a baseline care plan, that 48-hour one. And that's created through observations of the residents and discussion with the residents and family about their goals, and that's the most important piece there. So you might have a resident come into the facility that just wants to stay at their current level of functioning, or you might have a resident that's coming in to do therapies and want to go home. So you need to include measurable objectives and timeframes for when we want to get them home if that's their desire. Those can always change as well. Again, based on resident needs, resident goals, or our observations, those plans can change. The services those residents are going to receive to help achieve those goals is obviously a part of that. So are they receiving therapy? Are they receiving those mental health services? And then what sections are included in our care plans? I know Joanne had covered that. So we're looking at nursing, dietary, therapy, activities, and social services. Okay. So what you've probably noticed already, have you guys started doing this in Sioux Falls, Joanne? The eye care. Have you guys started the eye care plans here in Sioux Falls?
Yes.
Okay. So if you read through a care plan, you're going to notice that it's in first person as if the resident is saying that. And that really goes along with that resident-centered care goal that we have in our mission here. So wording that you're going to see is something like, receive the necessary care so that I may return to assisted living. It really makes the resident more involved in that process. And what you need to remember is that care plans are dynamic, meaning they can constantly change. Care plans are not set in stone. Goals may change from going home to staying at the facility and maintaining those current levels of functioning, or managing pain towards the end of life. What you need to remember is that it's each person's responsibility if the care plan needs to change. So you can go in and change the care plan as long as you're telling somebody, either your charge nurse or your department head, and then if you don't feel comfortable with that, just tell them that something needs to be changed. So if you notice a resident has a change in their daily routine that needs to be changed in the care plan, go ahead and change that care plan. We just need to make sure that's being communicated to the rest of the care team and the rest of the staff in the facility. So does anybody have any questions on that? Okay, we really want everyone to be involved. Making everyone involved is really going to help us accomplish our mission of resident-centered care. And as I'm sure you've noticed, we've been doing bedside care conferences here. So that's moving care conferences to the resident's room to have a more individualized feel. Really making it feel like we're having these care conferences in their home as opposed to a stuffy conference room. Just make them more comfortable. So our responsibility in relation to resident-centered care, read your care plans. There's no better way to understand what's in your care plans than to actually read them and have an understanding of what's in them. Have we started going over one, the start of each shift here?
Yeah.
Okay.
Colleen has done a really great job of really condensing. If you guys haven't noticed already, the 15, 20-page care plans are now only about 5. And that's got dietary, social services, activities, and nursing all in it. So it's really easy to read those care plans now. So I want you guys to get one out every shift. Marie has been starting this over on Promise, where she'll pull out a care plan and quick run through it. So I know you guys have seen them, but I want you guys to take the initiative to start reading through those care plans too, because they're going to ask you what's in that care plan.
Like I said, it's no longer just your nurse managers. It's no longer just the higher level people. It's everybody that needs to have an understanding of how to care for our residents. So that goes right into know the care plan. Everyone should have an idea of what's in the care plan and what those resident stated goals are. So like Joanne said, surveyors are going to start asking you what's in the resident care plan to make sure that you're following it. And then follow the care plan. So you might know what's in the care plan, but it needs to be followed. If the resident says, I want to get up at 9, but we're waking them up every day at 7 to get them out to breakfast and eating on time, that's not something that's going to fly anymore. We need to make sure that we're getting that resident up at 9. Again, surveyors are going to know the care plans, and they're going to observe to make sure that you're following them. Update the care plan. So like I said, if a resident has a change in condition, medication, daily routine, any stated goals, etc., you need to update the care plan as needed. This is everyone's responsibility. If you notice a change in a resident condition, tell the charge nurse. Constant communication between the care team and all the staff is going to be key in this. Document, document, document. That's going to be so important to make sure that we're showing that we're following our care plans. So the state surveyors are going to ask you, they're going to interview you to make sure that you're following your care plans. They're going to observe you to make sure that you're following the care plans, and they're going to look at our documentation to make sure that we're following those care plans. So then finally, know your residents. Spend time really getting to know your residents. Sit down and have a 5-minute conversation with one resident a day. Just getting to know who they are as a person, what they like to do, what their interests are. That's only going to help you further, gain expertise in how we can properly care for our residents. Ask what makes them happy, what they did before coming to our facility, how they prefer their routine to go. I know we're all very busy. We're all very busy. But just taking 5 minutes out of your day to ask your resident, how are you doing today? How can I help make your day better? That's going to be extremely important. Always remember, we work in our residents' home. They do not live where we work. Okay? Does anybody have any questions about resident-centered care?
I just have a couple comments. So that bedside care conference, I want you to know that you're all invited to join at the bedside care conference. Are you doing that already? Are you coming into the room if they're having a care conference? If not, can we make sure that we're inviting everybody in, because we need to hear from the people who are providing the care. What are the care needs of this resident? You know better. The only person that knows better is the resident. Okay, so you're our first line. We need to hear from you. So please come into those bedside care conferences and share with us what you know so that we can best take care of our residents. I'm going to be a Debbie Downer, and I'm going to tell you that it's extremely important that you know what's in the care plan, because as Joanne said, surveyors are going to ask you, and as Hunter said, they're not going to ask you, they're going to observe you, and they're going to check documentation and make sure you're following that care plan. It's possible that in the event of something happening to a resident because a care plan wasn't followed, and you were the person that was supposed to be following that care plan, it's possible that that's reportable to the Department of Health as an abuse or neglect situation, okay? So that's how important it is that you follow the care plan, that you know what's in that care plan, okay? So I want to share those thoughts.
Thank you, Deb. Again, it's everyone's responsibility. So we'll go over the quiz now. So the resident-centered care quiz. Number 1, resident-centered care focuses on the resident as a center of control and supports each resident in making his or her own choices. True. Within what time period does the baseline care plan need to be completed? 48 hours, correct. What sections are included in our care plan? All of the above. Care plans are set in stone and should never be changed. What's finalized?
False.
False. Care plans can always change. How often should a care plan be reviewed by the nursing staff? A, at the start of each shift, correct. Whose responsibility is it to know what's in the care plan? E, all of the above. It is all of our responsibility. Now I kind of screwed this one up. So what will surveyors use to ensure that you're following the care plan? Yes, it is A and C, but also include B in there. So they're gonna do documentation, interviews, and care observation. I apologize for that mistake. So spending time talking to your residents is the best way to get to know them and how they want to be cared for. True. Take that time to know our residents. Questions?